something that I see in my field is that, most patients and family members are operating from, obviously a non-medical viewpoint. And sometimes they just don't even know what questions to ask. How can we empower patients so that they don't feel limited in their care? And how do we make them aware of the treatment options that are available?
So I think the good thing about many breast centers is that they do have what are called navigators who really sit and handhold the patients through the process. And they sit and do one-on-one counseling. They try to find resources to help the patient get through treatment. They hold support groups. They really are a wealth of information and a nice go-between between the patient and the physician or the provider. So, trying to find a comprehensive breast center where they have a whole program that's dedicated to patient centered care, I think is important. I think it's also important that patients be empowered. If you go online, you can find what questions do I ask, print it out and bring it to your appointment and ask those questions. And it may take a couple of visits to get those questions answered. But I think it's important to get the questions answered. If you're with a provider who is feeling like they don't have time to answer or they're blowing you off when you're answering those questions, guess what? You can fire your doctor and go find another doctor. And I don't think we do that enough. I get on my patients and say, you know what? You all scrutinize when you go buy shoes, when you go buy that cute dress, when you go buy that new car. But we should scrutinize our providers because they're taking care of our most precious commodity, and that is our body.
That is absolutely true. I have fired a couple of doctors in my day, and I've recommended that some of my family members fire their doctors as well. So I really appreciate that coming from you, Dr. Hampton. And you touched on a little bit on what I'm going to ask next. And that really, staying on this advocacy piece, we've talked about the importance of patients feeling empowered. And you shared a really good tip, which I love, which is writing your questions down. It's something that I frequently recommend to my clients and my friends and family members.